Welcome to all of you in virtual land. I'm Dr. Rose Franco, the Associate Director of the Adult CF Program at Froedtert and the Medical College. I'd like to present to you our center data from 2019 as we're rolling over into 2021 very shortly. This slide represents the demographics of the patients we serve at the adult program at Froedtert and the Medical College. As you can see from the table in the center of this slide, we have 136 patients that we are following, of which 25 have been transplanted over the course of the years. We sadly lost 9 people to follow-up, and 5 people died in from our program over 2019. We are excited to see that almost 94% of our patients are eligible for highly effective modulator therapy. If we look at the number of patients we're seeing in our program, we see that on average we've accumulated an additional 8 patients per year new to our program, thus keeping our program size rather stable at about 130 to 140 total. In addition, in the demographics up in the right-hand corner, we can see that on average, it's about 50-50 for males and females, and that most of our patients are white, although we do see some Hispanic and some African American patients. And that our number of patients with homozygous Delta 508 is a little higher than the national average at 49%. You can also see from our graph on the upper left corner that we are consistently seeing patients almost every month of the year, minus the first few months of 2020, where people tend to wait to come in because of the concerns that they'd like to avoid the extra charge the first deductible of the year creates. One of the signs of a good program is how well our program is doing relative to 10 years ago. So in this scatter plot, you can see the FEV1 on the y-axis, which is the lung capacity, relative to the weight on the x-axis, or the BMI. And you can see that in 2009, by the pink dots and the star, the red star, that we've been able to shift in a positive way. Our lung capacity has increased and our BMI has increased. And this is prior to the advent of highly effective modulator therapy. Cystic fibrosis does more than just damage the lungs. It also increases the risk for patients to develop liver disease, bone disease, diabetes, and even GI problems. We cannot overlook the mind-body connection, as many of our patients also suffer from anxiety and depression. This graph demonstrates the trends in our patients' extra complications or secondary complications of cystic fibrosis. And as you can see, while we had a spike in the number of CF-related diabetes diagnosed in 2013, we've been pretty steady at having around 30% of our patients who are working on their diabetes, and as well a number of patients who are struggling with cirrhosis or scarring of the liver as a complication of their cystic fibrosis. One of the other areas where we often have difficulty is the GI issue, especially obstruction or distal intestinal obstruction syndrome, which is the adult form of meconium ileus. Luckily, this doesn't usually result in a surgical emergency for our patients, but rather is an enema emergency. And we've been lucky enough to have very few people who've needed that kind of extra support in 2019. The lower graph shows the number of people who are consistently using their medications to help prevent the complications of progressive lung disease. And as you can see, the major uptick is in the dark blue line, where we can see that by the end of 2019, we had nearly 80% of our patients on some form of highly effective modulator therapy. And this is super exciting because this impacts on all of the things we're looking at down the road to keep our patients healthy and long-lived. This table and the associated scatter plot demonstrate that on average we're doing fairly well with the number of patients who are struggling with exacerbations. I'm excited to tell you that in 2020 this number went way down, and that is through the magic of highly effective modulator therapy. So even though we had a higher than expected number of exacerbations compared to average of other programs, we expect that this number will put us in line with most of the programs where highly effective modulator therapy is being provided to just about every patient who is eligible. Part of what reflects back on the exacerbation rates is adherence. And this is where you who are tuning in can reflect on your own habits and those of your loved ones with cystic fibrosis. Are you doing the therapies that should be done on a regular basis to help keep your lungs from developing into bacterial super infections, or taking your enzymes and taking your stool regulating medications such as Miralax to help prevent the complication of distal intestinal obstruction syndrome? Let's take a moment to reflect on that. As you recall, highly effective modulator therapy for those with one copy of Delta 508 and those with a dual copy of Delta 508 who had been on Symdeko were eligible to begin Trikafta in late 2019. As a result of the forward thinking of the Wisconsin legislature, most all of our patients were able to apply for and get started on highly effective modulator therapy near the end of 2019. Those that were delayed in getting started were primarily those with health plans that were smaller and needed more one-on-one attention from our partners from the CF Foundation to help them understand how important and life-changing and transformative these medications can be. But as you can see from this graph, we were able to secure 53% of our patients on the Trikafta therapy, or elasticaftor, tezacaftor, and ivacaftor combination, which was head and shoulders above the median for most eligible programs in 2019. As I mentioned, cystic fibrosis-related diabetes is a significant complication of cystic fibrosis, and most adults with Delta 508 mutations and some of the other class 2 mutations and class 1 mutations are at highest risk for developing this complication as they get older into adulthood. This graph actually reflects back on how well we are doing at monitoring our patients with cystic fibrosis related diabetes, and how well we're doing at monitoring their diabetes care by measuring at least one hemoglobin A1C per year. And we were able to get 100% of our patients screened who have diabetes in 2019. We'd like to keep the graph that we can see in the lower portion consistently at 100% for 2020. One feared complication of cystic fibrosis that is rare is cirrhosis. What is not so rare is liver disease in cystic fibrosis. And as you will see from watching one of our plenaries, there is real evidence that this will become a major area where we will have to focus our attention over the next several years with our adult patients. Luckily, we only had one patient who had a significant liver disease problem in the last year. And you can see from the lower trend graph that we have been consistently reporting 1 or 2 patients per year in our program. Does this mean only one patient has cirrhosis? That is a good question. We're more mindful of it now and are starting to screen patients regularly by doing a right upper quadrant ultrasound with elastography, which allows us to see if the liver is got scar tissue in it. And that can also alert us to early changes in the liver that may lead to cirrhosis prior to the development of cirrhosis, so we can intervene and change the course for our patients and prevent cirrhosis from happening. Distal intestinal obstruction syndrome is a form of constipation that is very scary for patients who are suffering from it, and if left untreated could actually result in a surgical emergency, almost like appendicitis. The reason is the stool in a patient with cystic fibrosis is much firmer as it leaves the small intestine to go into the large intestine than it should be. In most people, stool is really all liquid until it gets into the second half of the colon. But in cystic fibrosis, it starts to become more like cement, quickset cement in some cases. And as a result, taking enzymes at the proper level, hydrating well, and taking stool softeners like Miralax are really essential components of the care in adult CF intestinal disease. This graph actually reflects back, telling us that we're doing a good job of managing our patients because only less than 1% of our patients have been diagnosed with distal obstruction syndrome in the last year. And you can see from the graph on the lower panel that this was much higher in the early part of the 2010-2020 decade. I would say that the reason that this has improved significantly in the last 5 years is a combination of the excellent work our dietitian Michelle has done, as well as efforts with highly effective modulator therapy at improving intestinal health. As I mentioned during the overview slide, one of the areas where we look at how well our program is doing is by looking at how well, on average, people's lung function is. One of the new areas that the CF Foundation has asked us to focus on is identifying patients who are developing advanced lung disease. Their definition of advanced lung disease is an FEV1 less than 40%. This group of patients is at higher risk for complications, as well as higher risk for developing rather abrupt acute respiratory failure. In our program, we have about 16% of our patients who qualify as having advanced lung disease by the definition put forth by the CF Foundation, which is around the average for adult programs, as quoted in the graph at 15%. We hope with the advancements with highly effective modulator therapy that we can see this number shift to a smaller percent of our patients, but recognize that this population will require a lot of our focus over the next several decades so that we can keep them healthy and keep them out of harm's way with complications related to their cystic fibrosis. So one of the areas that the CF Foundation has asked us to focus on in assessing our patients with advanced lung disease is by assessing their blood gas exchange, both at rest and with activity, as well as screening them for pulmonary hypertension. As you can see on the graph on the right-hand side, we have a ways to go. Only 6% of our eligible patients underwent the type of screening that is recommended now by the CF Foundation. We hope to see this markedly improve in our 2020 analysis as we have started to shift and focus our attention on these patients who are most fragile in our program. With that, I thank you for your attention and hope that if you have questions, you will provide them during our open question forum later during this program. Thank you.